Hello, and welcome to this session. In this session, aligned with Learning Outcome LO3, Understand the Use and Management of Data in Health and Social Care, we will examine how data is gathered, interpreted, and applied within health and social care settings. Our focus will be on understanding how effective data use can transform practice, enhance decision-making, and support improved outcomes for individuals and communities. We will explore the different types of data used across the sector, the principles of managing information responsibly, and the ways in which high-quality data influences service planning, patient care, and overall system performance. This session will highlight the growing importance of data in shaping modern health and social care systems and the benefits it brings to both professionals and service users. Clinical data includes patient health and medical history. Administrative data involves patient demographics and billing information. Public health data monitors population health trends. Research data advances medical knowledge through studies. Each type plays a vital role in health and social care. Data improves patient care through personalized medicine and clinical decision support. It enhances operational efficiency by optimizing resource allocation and identifying process improvements. Public health monitoring uses data for disease surveillance and health trends analysis. Research and innovation benefit from data-driven insights. Data is crucial for advancing healthcare. Effective data management involves accurate data collection and secure storage. Sharing data securely while maintaining privacy is essential. Advanced analytics techniques are used for meaningful insights. Data governance establishes clear policies and ensures compliance. These practices support efficient data use in healthcare. Data privacy and security are major challenges requiring robust measures. Ensuring data quality involves standardizing processes and regular assessments. Interoperability is achieved through standard data formats. Data integration combines various sources for a comprehensive view. Ethical guidelines ensure data is used responsibly. Personalized medicine tailors treatments using patient data. Clinical decision support provides recommendations based on clinical data. Continuous monitoring uses devices to track health metrics. Preventative care identifies at-risk patients for early interventions. Each approach enhances individual patient care. Data optimizes resource allocation, ensuring efficient use of staff and facilities. Process improvement identifies inefficiencies for better operations. Compliance and reporting ensure adherence to regulations. Supply chain management uses data to optimize inventory. Business operations benefit greatly from data insights. Workforce planning uses data for effective staff management. Training needs are identified through performance data. Continuous monitoring evaluates staff performance. Employee satisfaction data improves workplace conditions. Data-driven staff management enhances operational efficiency. Budgeting and forecasting rely on financial data for planning. Cost control identifies areas for savings. Revenue cycle management improves billing processes. Financial reporting ensures transparency and informs decisions. Data is vital for financial health in healthcare. Data-driven insights improve patient outcomes and operational efficiency. Personalized patient interactions enhance experiences. Compliance with regulations is ensured through accurate data. Strategic decision-making is informed by comprehensive data. Data is crucial for organizational success in health and social care. Strategic planning uses data to forecast service demand. Operational efficiency is improved by analyzing workflow data. Financial management benefits from data-driven insights. Data supports informed decisions across all management levels. Organizations rely on data for effective management. Service provision is informed by epidemiological data. Resource allocation ensures equitable access to care. Performance monitoring evaluates commissioned services. Data supports all aspects of commissioning. Effective commissioning relies on comprehensive data analysis. Clinical decision support aids treatment choices. Patient care management uses data for individual plans. Preventative care identifies at-risk populations. Data-driven decisions enhance care functions. Comprehensive data is essential for effective care management. Internal data includes clinical records and operational information. External data comes from government agencies and surveys. Both types are crucial for comprehensive analysis. Data from various sources supports informed decision-making. Health organizations rely on diverse data types. Health analytics derive insights from data for improved care. Big data integrates large volumes for comprehensive understanding. Both support strategic and clinical decisions. Advanced tools are necessary for effective data analysis. Health analytics and big data transform healthcare. Interoperability enables seamless data exchange across systems. It enhances patient care by providing comprehensive records. Operational efficiency improves through streamlined processes. Data-driven decision-making benefits from integrated data. Interoperability is vital for modern healthcare systems. Interoperability ensures continuity of care with accessible information. It reduces medical errors by providing accurate data. Comprehensive records support informed clinical decisions. Patients benefit from integrated care across providers. Interoperability is key to patient-centered healthcare. Streamlined processes reduce redundant data entry. Resource optimization is achieved with shared data access. Time savings occur through consolidated information retrieval. Interoperability enhances operational efficiency in healthcare. Efficient operations rely on seamless data integration. Informed decisions are made with aggregated data. Predictive analytics identify trends and forecast demand. Quality improvement relies on data from interoperable systems. Comprehensive insights support strategic planning. Data-driven decision-making enhances healthcare delivery. Access to information empowers patients in managing their health. Improved engagement occurs through better communication. Personalized care plans use data from wearables and apps. Patients benefit from active participation in their care. Interoperable systems support patient empowerment. The use and management of data in health and social care enhance patient care and operational efficiency. Effective data practices ensure informed decision-making and regulatory compliance. Data is an indispensable asset for health organizations. 02, 03, 04, 05. In conclusion, we have learned that interoperability plays a crucial role in ensuring high-quality care by enabling seamless communication between healthcare systems, improving data accuracy, and supporting timely clinical decision-making. Should you have any questions, please contact us via WhatsApp at 074843616888. Our team will gladly support you. Thanks for your time and see you soon.